Okay, maybe we should get started, and a few more people may trickle in, but just to be mindful of people's schedules. My name is Janet Popp. I'm chair of the New Mexico Adult Falls Prevention Coalition, and we're happy to have you joining this series. The Falls Coalition partnered with the Albuquerque Department of Senior Affairs to put on a series of series of virtual topics on various fall risk factors. So today we have Dr. Janet Simon. She's a podiatrist from the New Mexico Foot and Ankle Institute, and she'll be talking about how to properly fit shoes and some other aspects to how feet contribute to fall risk. I'd also like to thank other partners, certainly the Department of Health and others, the Albuquerque area, Southwest Epidemiology, Tribal South, oh sorry, 6-2, Southwest Tribal Epidemiology Center, oh boy, and other partners. This is certainly an effort that has taken many people. I would like to highlight that we still have 2 more presentations. Next week will be a presentation on various programs that can help you to improve your balance, and there will be some demonstrations and some practice. And then the final topic for the series will be home safety, and also what to do if you need to call the paramedics to come to help you because you've had a fall. That will be presented by someone from the Albuquerque Fire Rescue Paramedicine Program. In looking forward, the Senior Affairs is in the process of setting some Tai Chi classes that will be offered for free virtually starting in October. So you learn about some of the different aspects to how you can improve balance, and this will be an additional opportunity that you can do from your home to improve your balance, improve your strength, and be the best version of yourselves. So with that, I'd like to turn it over to Janet, and she will take over.
Thank you, Janet. Let us do that. Get that started here. Okay. Oops. Is everybody seen my screen share or not? Hold on. Is my screen being seen? Oops.
So Janet, we're still in sort of participant mode where everyone who has their camera on can see one another.
Okay, hold on. We're needing to get the screen share shared here. Here we go. There's a bit of a delay in this computer system here. Okay.
Yep.
So we are going to start from the beginning.
Mm-hmm.
There we go. Okay. So good morning. And since this is a day of remembrance, 19 years it has been since 9/11. I just want to take a moment of remembrance of all of us. Thank you. So moving forward, the topic of feet and falls obviously are connected. We know that we wouldn't be here without our partners. So thank you for supporting these educational efforts. A few housekeeping items. All participants, please mute yourself if you are not muted upon entry to the meeting. And please use the chat box to ask any questions. We are monitoring that and will take some time in the middle of the presentation to review any questions that participants may have posted. Folks who have called in on the phone, you are muted and can be unmuted by pressing *6. Thank you. Okay, so moving forward. So just some basic objectives. I am going to review the impact of falls. I will be looking at the multi-factors that contribute to falls relating to the feet and lower extremities, and we'll be reviewing footwear choices. I have no disclosures other than I really love New Mexico and our wonderful environment and communities. Why we are bringing this whole month of information to the public is the fact that there's just too many falls. Too many of our older people are experiencing falls, and obviously the consequences that occur with falls. The important part of this particular slide is that only half of the people who experience falls actually talk with their doctors about what may have happened. And I can say, even within my practice, where I'm asking people often, since I see people on a regular basis, you know, anything has changed since your last visit. Often falls are not immediately revealed. It's only after, for instance, I see that they have bruising or something that raises my suspicion that a fall may have happened or something happened, let's say, that this discussion moves forward. Here in New Mexico, we are in a bit of a high area percentage-wise of our population who experiences falls, right around, as you can see, about 30%, which, as you can see in this slide, after age 65 plus, 1 out of 3 people fall each year. So there's our almost, 30%. As we do get older, the risk of falls increases. And this is a slide that is identifying, obviously, the community falls, meaning people out in the community, living in their homes and assisting cares and such, that the percentage of falls, unfortunately, is very high. We also know that in other facilities, hospitals and nursing homes, that falls are a continued concern. And there have been certainly, let's say, attention to this. And a little later on in the presentation, we'll talk some of the ways that they have attempted to address this in some of these locations. I believe one of the areas that have been receiving some increased sort of focus are people that certainly have been discharged from hospitals to home and are continuing to receive some form of home health care, rehab, that attention to falls prevention is clearly integrated into this type of service. And hopefully will continue, because this is a great opportunity, obviously, to integrate different parts of falls prevention. What are the human consequences of falling? First is people obviously develop a clear loss of confidence and a fear of going out and walking and doing exercise that they had enjoyed before. It also then leads to a decrease in functionality. Injury. That's the biggest part of falls, is that people sustain traumatic types of injuries, soft tissue, bruising, as I sort of mentioned earlier, that I can see when people are coming in, fractures, and traumatic brain injuries. It can also certainly lead to a high level of some permanent disability, especially after hip fractures and the traumatic brain injuries. So everything obviously that we can do to prevent these from happening is very good. And as we know that after many of these types of falls with the functional decline, it often leads to independent individuals needing increased care. And we know that nursing home placement after falls is a higher frequency. And we clearly know that fatalities, loss of life from falls, is very high. And this is probably where some of the focus began when we started seeing this clear increased trend line starting, this particular graph starts in 2004, of the increased fatality rate. So there has been very much an increased conversation about falls prevention and the various integrative ways that we can hopefully address falls. So this graph clearly looks at the breakdown of the types of injuries. And we know that the biggest area of injury happens with hips, which then clearly affects people's mobility to be independent and to walk. I know I see a fair number in this graph that gives an estimate about 10% of lower extremity fractures, which can also be very debilitating. And this also just gives sort of a breakdown, so I'm not going to spend too much time here. Obviously, it has a huge impact with that. And speaking of huge, the financial impact is clearly very significant and not too unusual. Most of the costs are being essentially shouldered by the Medicare and Medicaid programs, since a fair percentage of these fall-related costs are to our older population. When we talk about our risk factors, we know clearly these several bullet points are the ones that are often looked at in many of our falls prevention programs. And many of the other lectures are clearly looking at these elements in a little more specific fashion. I'm going to include a few of these as we go forward. Since in medicine, we clearly want to be aware of the medications people are on. And this is one of the areas that we review, hopefully, at everybody's visit, knowing what people are taking and potentially the side effects and impact this may have on their functionality. I encourage all of my patients to certainly talk with your physicians about your medications and have a clear understanding of, one, why are you taking the medication and what are the potential side effects, and how, if you are having side effects, how can you manage those? Those are clear conversations every individual needs to have with your physician. I don't encourage patients just stopping their medications without talking with their physician, because obviously there is a reason you're on the medication. But speak with your medical provider to understand, maybe a lower dosage is appropriate for you if needed, or alternatives. Talking about falls without really looking at the environment that you're functioning in is a real disconnect. You really need to take a look at your living environment, especially currently, since we are all probably spending more time at home, that we want to make sure that our living areas are safe, that our animals are not necessarily under our feet, our carpets aren't rolled up or having creases in them, that we have plenty of light, and that furniture gives plenty of room to be able to move, especially if you are using any assistant type of devices such as walkers and such. You need extra room to be able to safely use them. As these pictures show, clearly the pictures on the right, uncluttered, pictures on the left, clutter. So making an effort to, clean up is a good thing. That is falls prevention 101. And I do speak with my patients about clearly outdoor factors. And as the picture in the center shows, there is a point where we all should stop climbing ladders, getting up on the roof to change, the windows or the swamp coolers. There's other people that can help out with that. And I know through the various organizations, if you don't have resources that can help you find people, there are plenty of resources in our community, say through our senior affairs organization, that can help find people that can assist in these types of home upkeep activities. Outside fall factors, including sidewalk maintenance and watching out for where sidewalks are uneven. I know I'm involved in my neighborhood association, and we have been actively trying to get our sidewalks updated and ADA compliant in our neighborhood, and that actually is happening right now. It's been exciting to get that worked on, but often that's not an option in many places. So the advice is to be aware, and if you have difficulty in navigating, making sure that you're using assistant devices that can help keep you safe. traditional falls prevention programs have focused on these 4 areas. And one of the talking points that I bring into the conversation is that foot health and how feet are important in falls prevention needs to be one of these bullet points. So I have appreciated the recognition here in New Mexico of the importance that maintaining good foot health is to falls prevention. I do feel it is a neglected risk that we know foot problems impact a good number. It says here 1 in 3 of our community dwelling people have foot problems. And I can say the impact of that is such that these types of what has been identified in the literature as the podiatric risk factors, the foot deformities such as, the severe hallux valgus is our term for bunions. So the picture on the right, or the x-ray picture on the right, is depicting a pretty severe hallux valgus bunion deformity. I'm going to go through all of these in a little bit more detail as we go forward here. A lot of this information has been done in good research that has come out of Australia and New Zealand. And part of that is because they do have a much better sort of integrated public health system in their countries, that they can do a much better job at gathering this information for us. So what this is talking about here is fallers have demonstrated ankle joint motion, and that there's an increased lack of digital toe grip strength. We know that as we do get older, and especially in some of our higher risk populations, such as our diabetics, they have a greater tendency for loss of feeling in their feet, which certainly adds to the risk of not knowing where their feet are on the ground. And foot pain by itself is a clear risk factor. If your foot hurts, you're going to be compensating how you're walking, and you're going to be imbalanced. And I've obviously talked about in the former slide about the clear identification that having bad bunions cause an increased amount of falls. Foot pain is not normal. Foot pain is a clear sign that something is probably pathologically wrong. So we certainly encourage people, if they have foot pain that they can't identify the reason for. I mean, clearly we have all stubbed our toes and we know that's going to hurt. That's an acute pain that generally should go away, within a day or two. But if it doesn't, that probably means there's something else that needs attention. So we do clearly want people to not ignore their foot pain. We also know that managing foot pain and lower extremity pain is often a team approach. And that's where I call upon my good physical therapy friends in the community to often participate in a treatment plan. Common causes of pain in the feet, and clearly this is just touching on some of the many reasons people may have pain in their feet. A lot of the inflammatory conditions, whenever you hear the term itis, that just means an inflammatory process. So we know that a lot of different structures in the feet can get inflamed. and can start creating some ongoing pain. Overuse tendon type of injuries, the heel pain, often identified as this plantar fasciitis, can often be something that it's there, it can come and go, it can be chronic in some people. We know that generally many of these types of overuse injuries can be better controlled and hopefully resolved in people with a good treatment plan. Arthritises, several are cited here. The rheumatoid RA type of arthritis often leads to pretty severe type of foot deformities that often create imbalances in the feet that clearly have a higher risk of creating imbalance and increased falls risk for people. Many of the other wear and tear type of arthritises, the osteoarthritis or degenerative types of arthritis, leads to a lack of ability to move joints without pain. And then the gout, which is due to uric acid being either overproduced in our system or not excreted in our systems, can create clearly a lot of pain in our feet. We know that gout often in many people will initially present in feet, although it can present in other body areas. But commonly we will see people who don't relate that they might have gout, and when they come in and we see some of these telltale signs, we know that it probably is. And the good news is that there are clear treatments for gout and that it should be treated. It's not something that should be ignored. Bunions, we know, tend to be a inherited type of problem. And as you can see in this slide, this is a milder or moderate type of deformity being shown. And often this level of deformity is not always painful, but it's not the size of the deformity that counts. Often people begin having symptoms at this stage, and we know that there are conservative treatments that can reduce the symptoms. As the deformities get to be more progressed and more severe, we know that these are the levels of deformities that start creating the clear imbalances that people have. So one of the talking points that we often make to people is about correcting these types of more advanced types of deformities. Hammer toes, as you can see, this is a cocked up, contracted type of deformity. And often the toe at the top of the deformity is painful in shoes that obviously rub, but also underneath because it changes the whole sort of mechanics, how pressure is being distributed to the metatarsal head. So often this type of deformity, as pictured, people are having a fair amount of pain right on the bottom of the foot. And this is a study that was certainly looking at the toe deformity and weakness and how it contributes to falls. And again, it just identified the correlation of the more severe types of bunions and lesser toe deformities having a higher rate of falls. This type of tendon dysfunction is one that is often a slow progressive type, but I have known patients who have come into my office and said, you know, it seemed like my foot just collapsed, that all of a sudden my arch just wasn't there one day. And that unfortunately happens. However, there usually is this precursor of the posterior tibial tendon probably having some symptoms that most likely were ignored before the more advanced stages happen. One of the ways of identifying this type of problem with the posterior tibial tendon is we ask people to stand and then raise up on their toes or raise their heels off the ground. And then we have them stand on one foot and do that same toe raise test and see if they can raise their heel off the ground. And in this condition, a lot of situations, people can't do that on one leg. So that is somewhat of a indication that that tendon is dysfunctioning, or in some cases, maybe ruptured. Drop foot is another common type of lower extremity problem that we often see, and it is a common sequelae or side effect after people may have experienced a stroke, that they are left with a drop foot. And as is pictured, that dragging foot clearly is going to have an impact on balance and a normal gait progression. So we often, through rehab and types of different bracings and such, can certainly help to keep that foot from being dysfunctional. Short limbs, having a leg length discrepancy, is clearly another area that impacts people's balance. I can tell you I see a very large number of limb length discrepancies in my practice, especially as people get their bionic body parts. When people have hip replacements and knee replacements, we often see some level of limb length discrepancies that can affect, you know, the balance. So this is something that I don't tend to ignore. It is something that I feel gets more progressed as we do get older. So even if you may have had a slight limb length discrepancy when we're younger, that sometimes can be accommodated just by our more flexible, youthful bodies. But as we get older, it's not allowed, basically, that accommodation. Peripheral neuropathy is another major impact on our feet, and not just because of diabetes. We see a much larger group of people are cancer survivors who have undergone chemotherapies and such, are often left with peripheral neuropathy affecting their feet, which clearly, as the slide documents here, leads to a loss of balance and can't feel the ground, all obviously a part of keeping your risk of falling to a higher extent. This was a study that looked at, in diabetics, does neuropathy by itself have an increased fear of falling? And it did seem to have an impact. You know, people not necessarily feeling 100% where their feet are. Often my diabetic patients or neuropathy patients in general will say, I feel like I'm walking on pillows. Very unstable type of sensation. So let's talk about addressing, you know, some of our deformities with surgery. Is there a demonstrated value on intervening with reducing falls? And this study actually are of some of my podiatry peers who I interact with in our public health world completed this study. Although it is a small study, obviously with only 40 adults, it did identify a clear correlation with an improvement during double and single balance assessments. So we certainly do feel that they're in the correct person. Surgery may be of value. Why don't I maybe stop here? Are there any questions? Because the next portion sort of goes into footwear. So if there are any questions that might be present, I can address them now, or we can obviously address them at the end.
Are there any recommendations for nutrition and foot and the feet?
That is, I would offer, yes, in fact, I have, when I talk of the neuropathy types of treatments, that nutrition is a part of that. I mean, clearly, if we're treating our whole bodies well with good nutrition, it will have a direct impact on our feet. But there are some specific recommendations for our neuropathy patients. The same way, going back to the gout, we know there is a direct correlation between foods that have a high purine content. Purine is a precursor to uric acid. So we often talk to our patients and have a handout in regards to what, if you are having gout symptoms, what foods you want to be aware of, foods clearly to avoid, and foods that potentially could be helpful with that.
Thank you.
Okay, so moving into footwear risks, obviously I get a chuckle out of the presentation of that extremely stylish shoe being pictured, and probably no one on this meeting today hopefully will be wearing that type of shoe. Being a shoe person, I always say, you know, high heels, stylish shoes are beautiful to look at, and they are pieces of art. They are not really good for your feet. We know from the studies, although the numbers of studies really looking at footwear are not as robust as other studies relating to falls, but we do know that walking barefoot does increase falls risks. And this particular study said by 11 times compared to athletic or you know, a low canvas type of shoe. In hospitalized patients with hip fractures, it was identified that they were wearing slippers And I have a slide that will discuss that about. We know that poor fitting shoes certainly is a risk factor in falls in this particular study done in a hospital environment. And then we just know that in general, the selection of footwear, we know that when many people telling someone that they have to wear a different type of shoe, often for aesthetic reasons or loss of their own independence, often is difficult. Clearly, we know why they call slippers slippers. There is a clear correlation with falls and the wearing of socks here. Now, in this picture, you can see the type of slipper, a scuff, I believe they call this type, is what we are talking about. And I will have what my recommendations are in a slide or two later. Here, this type of a scuff or a very flimsy type of shoe was correlated to an increased incidence of hip fractures. I tend to use this term suboptimal. Again, often the types of shoes that are highest risk patients may be using in hospitals, in nursing homes and rehab facilities are probably the worst type of footwear for them on their feet. So I really encourage my patients and certainly their families to make sure that they are getting types of shoes that are going to be optimal for their loved ones, especially if they're being in a rehab facility, because the goal of rehab is to get people up and walking. We want them to be walking in a balanced, safe manner. So these are recommendations of optimal house shoes. Something that clearly has a outer stiff sole. Several of the slipper on the left has a removable insole. The slipper, actually it's not a slipper, it's a Merrill clog, has options of removing the insole to potentially use a orthotic type of insert. There's many types of this clog type that has a stiffer soled bottom that again can be easily slipped in. You know, I tell my patients I'm not just telling them they have to be in their athletic shoes all the time. I get it. People need to have a shoe that they can slide on, you know, in the middle of the night to go to the bathroom. We know people have to do that. So we know there are options out there that are better than the more flimsy type of shoe or slipper. So talking about walking on slippery surfaces, and this is where now I know many of our hospital systems automatically dispense this type of a non-slip sock to the patients in hospitals, which is an effort to reduce their falls risk when patients are inpatients. It's certainly a better option, but it's certainly not as good as having a better slipper or shoe on your foot that can support your walking. But it's certainly better than going barefoot, or worse yet, having, you know, a slippery nylon type of sock that, you know, you're going to certainly fall with. Heel height is important in our shoes. Again, the higher the heel, your center of gravity gets changed, displaced, and you become more imbalanced. We also know that with increased heel height, you're going to have a shorter stride length and you're going to walk faster, which often can increase basically your imbalance. And it does lead to certain decreased muscle activities. The gastrocnemius is the big muscle that crosses the back of your knee and ankle. It's actually one of the more unique muscles because it crosses two joints in your body. So it has a very large impact on foot and ankle function. We know, and that is why we often include calf stretches in many of our protocols for foot and ankle rehab and maintenance. We want to keep that calf muscle as flexible as possible. Sole cushioning is certainly important. The sole hardness in this study did not clearly have an effect on balance, but we do know that thicker, softer shoes often can impact the awareness of where your foot position is. So I often know with certain individuals, say our patients who have Parkinson's, we really have to address making sure that their footwear choices are optimizing their ability for them to know where their feet are. Collar height, or just basically, you know, what we call high tops, they do help with stabilizing your mechanics. We know high tops are unfortunately harder to come by now, especially stylish ones. Many of them often would be appropriate maybe for your grandkids or others, but in truth, they probably would be really good for you as well. We know they do help to control your basically medial lateral, or the way that your foot moves, rolls from side to side. That can be very much helped by a higher top shoe, as well as it says here in our patients that have neuropathy, our neuropathic patients, the nerves in their feet are not telling their brains correct information. And that is obviously leading to some of the increased sway problems that they have while walking. Are orthotic inserts helpful? I believe so. I use them quite often in getting my patients' feet better balanced. And if we can control some of the excessive types of overpronation or oversupination, that will lead to, again, you know, a better functioning foot and increased balance overall. Is bracing effective? This is an interesting area because there has been, in falls prevention, a segment of the medical community that have sort of come forward saying that we should be, you know, considering bracing for all of our high-risk patients. I have not totally felt that that is what should be done. I'm not like, you treat everybody the same way. So I do feel that this needs to be sort of a case-by-case evaluation, but there is clear evidence in certain groups that bracing certainly can be helpful. And I can say in many of my patients who have severely overpronated feet that bracing can be helpful. Yes, unfortunately, sometimes I have to tell people bad news that they might have to start wearing better shoes. Do older folks perceive footwear to be beneficial? Sometimes, and this has been an interesting area. And a little later on, there's some of the pictures that I will talk about what has caused older people to, I think, have this pushback about wearing what might be considered orthopedic therapeutic shoes. They're ugly, they're heavy, they're big, all of that kind of discussion. So what's key in shoe fit? Proper sizing. We know that our feet change over time, and they may often change quite quickly within several months. So making sure that you are getting your feet measured on a regular basis is important. That wonderful device that's being shown is called a Brannick device. And my cousin Jessica, who's on this webinar, will know where this comes from because it's from her hometown of Syracuse. And the Brannick device is still made in Syracuse, New York. Family operation. We know that fasteners, closures on shoes are important. Having just a slip-on shoe is not the most stable shoe to be using. And then again, correctly matching your shoe with your activity. We don't want you out on the trails barefoot, and if you do like those other shoes, I'm not quite sure what you might want to be doing those with. So what's recommended? We like a shoe that has a good heel collar or counter to it, lower heel height, firm midsole, slip resistant sole, and some kind of a fastening mechanism. Worn out shoes, get rid of. Unfortunately, most of the shoes nowadays don't necessarily have the capability for getting them resold. Some do, but most of the shoes really, when they get to this point, throw them out. So let's choose. Which of these shoes would we all like? I'm a big Merrell fan. So the shoe on the right is the shoe that I like to actually personally use. Again, the Merrells have a removable insole that can be replaced for extra cushioning or for orthotic usage. Shoes that have some form of a fastener. Again, the shoe on the right has an instep strap that is adjustable with Velcro, so that can accommodate a variety of instep heights. The little ballet princess slip-on, although easy to get on, is not particularly stable. And then your walking shoes. The KED type of shoe on the left, again, is not supportive. It's extremely flexible. We tend to recommend a shoe that has a bit of a more firm outer sole and, again, a deeper heel cup area. And this is what I was referencing. This is what people sort of imagine the therapeutic shoes. But this is actually the therapeutic shoes that existed pre-21st century here. These are the shoes that are available nowadays. Very, I think, much more aesthetically pleasing, made out of lighter weight materials that can accommodate a variety of shoe structures. So in our shoe fit pointers, we want to make sure patients have the correct what we call arch length fit, that the ball of the foot is fitting correctly in the shoe. So when we measure on that Brannick device, we are actually measuring two length measurements, your foot length and your ball length. And it's actually your ball length that fits the shoe correctly. Then we have to identify, do you have really long toes? Do you have short toes? And sort of figure out from there. A good way of identifying whether your shoe is fitting correctly, as is shown here, is to take the insole out of the shoe and stand on it and see where your foot lies. If it's lopping over the edges of the insole, we know that you're probably much too short or narrow in your shoe fit. This is also a myth that snug fitting shoes fit better. We want plenty of room for your toes to be able to move and for your arches to work correctly. Nowadays, we have flexible vamps, which are very much great for people with foot deformities. This will allow bunions and hammer toes to not have stiffness and irritation. And there are a wide variety of those types of shoes available. And here's just some general other shoe fit advice. It is better to try on shoes when your foot might be a little bit more swollen towards the end of the day. Keep in mind that shoes, even within the same brand, are not going to fit exactly the same. No two feet have the same sizes. We all do have probably one foot that's a little bit bigger or wider than the other. And we do know that shoes should break in, but they are not going to necessarily feel, more comfortable if they're not comfortable at the time that they are being fitted. And we don't advise that people use other people's shoes. So this is our Q&A. I think we have a couple minutes left. Any questions?
So Janet, thank you. There were a couple of questions earlier in the thread, so just to save a bit of time, some are asking your opinion about certain kinds of shoes. So yoga toe shoes, clogs. That actually was a question from my mother who couldn't attend today.
Mm-hmm.
What are your, and also if you have any recommendations for types of devices for bunions. So those are three questions so far that maybe you could first address.
So quickly, in terms of like yoga shoes, I actually do feel that they can be helpful for people. I am a big believer of intrinsic foot exercises, and the usage of the yoga type shoes is helping with sort of exercising the intrinsic muscles in our feet. So I think they can be helpful. My adage, or what I usually tag on to answering this type of question, is I would not want to wear yoga shoes out on the hiking trail. I think it's, when are they appropriate? And the same thing perhaps with clogs. Clogs can certainly be very helpful for many people, but depending on what people might be using them for. I wouldn't necessarily use a clog going out for exercise walking. But as a shoe around the house, as a casual shoe, potentially yes. However, there are certain foot structures that don't work well in clogs, in a rigid sole clog. And then I think the question was, I'm sorry, the last one was?
So someone was asking about types of devices for bunions.
Bunions, right.
And there's also a question about thoughts on keeping your feet supple.
Okay, so I mean, splinting of bunions can be helpful to realign the joint. They can often reduce some of the achiness that people experience in the bunion deformity. So yes, they can be helpful with that. They are not going to undo bunions. They're not necessarily going to slow down the progressive nature of bunions. And suppleness, the reference I just made to doing intrinsic foot exercises, basically like a towel grab exercise where you put a towel on the floor and you sort of scrunch your toes up is good. I have a sheet that talks about like playing the piano with your toes. Those are all very good. A lot of the yoga exercises that are there can be helpful. For instance, I know being somewhat of a yoga practitioner myself, there are exercises in which you use your hand. This is my foot, that you essentially spread your toes apart with your hand. That can be very helpful to creating space, because we're in shoes and socks and compression stockings a lot that cause our toes to, become very tight. So doing as much sort of range of motion stuff with our toes is very important.
That's terrific. There are a couple more questions that have come in if you have a few extra moments. So one is, and it was a question I neglected to ask, it was asked earlier in the talk, but the person asked about hip replacements and if that increases falling, even if there is not a difference in limb size. And then there's also a question on how to treat hammer toes.
Okay. Let me say about increased risks following total hip replacements. I don't believe so. And I will say that's not my area of expertise. What I can say is often with my patients with total hips, they become more confident because their hips are working better than they did prior to the hip replacement. They're not having the pain that they had with the degenerative hip problem, and they often, are much more active following their hip replacements. In some cases, there may be, some limitations of how far the hip, can move and some flexibility issues in that regard. But I don't believe in my patient population I've seen a significant risk, let's say, of increased falls with that. And the recommendation about hammer toes, a lot of more flexible hammer toes, definitely exercises are good to do to, keep the toe as flexible as possible. There are a variety of padding, crest pads, hammer toe types of splints out there that often are helpful with people. Often surgery is a recommendation. Often the hammer toes become either painful from rubbing on the top of the deformity or on the bottom, and that creates an ongoing soreness, calluses, corns, that at some point we often do recommend surgery, which then often decreases, some of the other issues that come with the hammer toes. As I had mentioned, oftentimes it's not just the hammer toe that's a problem, it's the fact that they're having metatarsal head pain as well.
Okay, I don't see any other, there's one more question. So exercises were talked about quickly. Can these be included in the follow-up inserts that are emailed? So do you have something specific that you might be able to share as far as the exercises you were referring to?
Yes, be happy to.
Okay. Well, any final thoughts, Janet?
I just thank everyone for their attention and bringing this topic forward. I do know it is very important, again, as a part of all of our goals of maintaining active, independent lifestyles. Our feet are a key component of that. When we don't have good foot health, it certainly affects everything.
I second that. So thank you for your time and your presentation today. Janet, we will forward, or the department is, we meaning the Department of Senior Affairs, will be sending out the link to where the information will be posted. And again, we have 2 more presentations. Next week will be various programs that help you to improve your balance. There'll be some short demonstrations. And the following week will be home safety. So thank you for your time. And I hope everyone has a nice weekend and stay well.
Yes. Bye-bye.
Janet, can you hold on for a minute? Do you have a minute?